Good afternoon, everyone. Before we get started on this week's message, let's get our weather from Colin Schaefer. Colin, take it away.
Thank you, Mayor. Good afternoon, everyone. This is your junior meteorologist, Colin Schaefer. Before we get started, I would like to say congratulations to all the graduates of Bayonne. We certainly made history. I am proud to say that I will be attending Bayonne High School in September. Also, please support our local businesses. Now let's get started. It's currently Sunday, 5 degrees in Bayonne right now, cloudy. Tonight it will be cloudy with the low 64 degrees. Tomorrow we have thunderstorms with the high 80 degrees, low 67 degrees. Saturday we have thunderstorms with the high 82 degrees, low 60 degrees. Sunday we have sunny with high 71 degrees, low 53 degrees. Monday we have sunny with high 69 degrees, low 51 degrees. Tuesday we have mostly cloudy with high 71 degrees, low 53 degrees. Wednesday we have mostly cloudy with high 73 degrees, low 58 degrees. And Thursday we have rain with high 75 degrees, low 57 degrees. Thank you for watching. If you haven't seen my videos already, or if you're new to my weather reports, you might see a few videos of on OEM Facebook and Twitter page. Goodbye, everyone, and Mayor, back to you.
Thank you, Colin. Good afternoon. Today I've asked Mike Rosanoff to come and speak with us. Mike is an epidemiologist from Columbia University that lives here in Bayonne and is part of my COVID-19 task force. It has been a pleasure and a great benefit to our community to have Mike as part of our team. He has been working closely with all the task force members in keeping our city safe. Mike?
Thank you, Mayor Davis. Good afternoon. My name is Michael Rosanoff, and I'm an epidemiologist and public health professional proudly serving as a member of the Bayonne COVID-19 Task Force under the Office of Emergency Management and the leadership of Mayor Davis. I'd like to take this opportunity to briefly discuss the journey that we've all been on for the last 11 weeks, since the World Health Organization declared COVID-19 a global pandemic on March 11th, and since Bayonne began implementing efforts to mitigate the spread of coronavirus in our city. I'd like to discuss where we began, how we got to where we are today, and what we might expect over the coming weeks and months as we continue to address the pandemic in our community. Bayonne, New Jersey had its first confirmed case of COVID-19 on March 18th. Nearly 1 week earlier, any parent of a school-aged child in Bayonne would know the decision was made to preemptively close schools. This was a critically important step taken to slow the spread of the virus and to protect our children and teachers. Shortly thereafter, restaurants were restricted to takeout only, retail stores were closed to customers, and our state's directives to stay at home began. Essential services like grocery stores remained open, but the number of customers were limited, senior shopping hours were added, and anyone out in public was asked to stay 6 feet apart. Our world of social distancing had begun. Why did our city and state take these measures? The purpose was to slow the spread of the virus and flatten the curve. This term was used to describe how reducing our exposure to one another could reduce the rate of new COVID-19 infections and avoid a potential tidal wave of new cases in a short period of time. The fear was that a rapid surge in cases could overwhelm our hospital system and limit our ability to treat patients, as beds, ventilators, and personal protective equipment were all in limited supply. Fortunately, we never got to that point in Bayonne. We certainly came close, but our frontline healthcare workers remained strong. Our community remained strong. Because we listened, stayed at home, and followed the social distancing guidelines, we were able to flatten the curve and slow the spread. This brings us to where we are today. We are at a place where we are seeing a consistent and steady decline in the number of new COVID-19 cases and new hospital admissions. We have met criteria to begin to reopen aspects of society, but will need to do so slowly and in stages. We should be proud of our collective commitment to slowing the spread of the virus and be hopeful that the worst is behind us. However, we should not mistake this moment as the end of the pandemic. While our goal has always been to slow the spread of COVID-19, we also know that it will take more work to stop the spread altogether. What we know about infectious diseases is that a certain percentage of the population needs to have immunity to the virus before we can stop the spread. Some scientists estimate that 60 to 80%, or up to 8 out of 10 people, need to have immunity to COVID-19 for new infections to stop. We do not know how many people have immunity to COVID-19 today, but it's likely well under that number. It's still unclear whether recovering from COVID-19 and having antibodies to the virus is enough to be immune from reinfection. What we do know is that the preferred way of achieving that 60 to 80% immunity is by finding a COVID-19 vaccine. While there are some very promising clinical trials taking place and the studies are being accelerated, a vaccine is not expected to be available before the end of 2020. What this means is that we are not out of the woods yet. We shouldn't be fearful, but we must be mindful that the virus is still out there. It's still highly contagious, and it can still cause very serious illnesses for some people. As the weather is turning nicer and society begins to reopen, it might be more difficult to adhere to social distancing guidelines, but we must continue to do so. Though we may no longer be told to stay at home, we are still safer at home. We must continue to maintain 6 feet distance from others, not only in supermarkets, but at the park, or if we're walking the Bayonne Bridge, or any time we are out in public. And research has shown that wearing a face covering does significantly reduce the spread of any respiratory droplets that carry the coronavirus. So please continue to wear a face covering in public and always wear one when you may not be able to adhere to that 6 feet distance guideline. Many of us will want to visit with family and friends that we haven't seen in weeks. The best guidance is to continue to limit your exposure to others outside, and outside of perhaps a small and select circle of trusted family and friends. Choose your small circle and stick with it. This is not the time for large gatherings. Most importantly, we must protect our family, friends, and members of the community at highest risk of severe illness from COVID-19. That includes our seniors and others that have underlying health conditions. If we remain vigilant, we will continue to see the steady decline and plateau of new COVID cases through the summer months. But we must also prepare ourselves and our community for the possibility of a resurgence of the virus and another wave of cases, particularly as we get into fall and winter, when we start to see cases of seasonal flu appear as well. While we continue to be hopeful, we must not let our guard down. And if we do start to see a resurgence, we will be ready. Bayonne has already demonstrated that as a community, over the last 11 weeks, we will do what it takes to protect our loved ones and our neighbors. Let's all continue to recognize the incredible work and sacrifice of our frontline essential workers and emergency personnel. And let's remember those in our community and around the world and around our country who have lost their lives or family members to this pandemic. Thank you again for following the guidelines. Please continue to wear a mask, wash your hands, and practice social distancing. And most importantly, stay strong as we overcome this pandemic together. Thank you.
Thank you, Mike. As everyone is aware, things are changing rapidly in New Jersey. The governor has been updating the executive orders almost on a daily basis. We all need to keep an eye on these changes as we are chomping at the bit to get our city back open. I am committed to seeing our businesses come back and thrive again in our growing city. We need to keep up the momentum that we had before this pandemic hit. Fortunately, our city is doing very well right now, and we need to continue on this path. The cooperation of all our residents has helped to see a steady decrease in current positive cases. Please continue to follow these directives so we continue to see the slowing of COVID-19. Again, I want to express my thanks to every resident in Bayonne. Even though this has been an incredible challenge, we have all stepped up and met this challenge head on. Stay safe, stay well, and we'll talk again next week.